In trying to assess someone who has chronic fatigue, it's important to look back and see what happened at the onset of the problem and to see if you can isolate exactly what kind of problem may be leading to the fatigue. So if someone comes in and says, well, I just haven't been able to do the same things and I'm not the same person since I had a divorce or I had some other major psychological stressor in my life, then that becomes a focus of trying to figure out why this person has long-term fatigue. If there was some kind of damage to a vital organ, so that if there was a heart attack and then since then there's been fatigue, well, then that's another obvious reason for the person to have fatigue. And echocardiogram or other assessment of the heart becomes an essential part of the workup. If there was pneumonia to begin with, then potentially scarring in the lungs and inefficient oxygen exchange may be the problem. Sometimes vitamin deficiencies or deficiencies of other nutrients that should be coming in through your diet becomes the limiting factor, and then there's no other way to correct the problem other than to replace that vitamin. For some people, hormonal changes can be the reason for chronic fatigue. So menopause is one reason that people go through a period of change in their hormones and then the proteins that bind their hormones, and then as a result an individual can develop low thyroid condition without having anything wrong with their thyroid. Exposure to some environmental toxins, maybe even electricity that comes through your appliances or is present in your house at levels that it shouldn't be, can also potentially lead to some problems in your system. And also viral infections, which oftentimes we know someone had a viral infection that led to fatigue, and it's quite easy and clear to diagnose, but sometimes as we're seeing with some people who develop long COVID, a viral infection can be quite mild, but it doesn't resolve the way that it should and leads to a condition that is chronic and causes long-term fatigue.